Welcome back to Taking Charge of My Cancer, episode 76. I have a very special guest today, Emily Venglar. She is actually my current undergrad student. So she is an Applied Physiology and Kinesiology student here at the University of Florida. And I have had the pleasure to have her here for almost 4 months. Next week is going to be her last week. I'm going to miss her a lot, but she is just going to really, I wanted to invite her just to see the perspective from somebody who is going undergrad school and have maybe never exposed to oncology. And so see what her, vision was and what she learned. And I think she can really bring some nice tips to my audience. So Emily, welcome and thank you for being with me today here.
Thank you for having me. I'm really excited.
Very good. So tell us a little bit about you and, why do you plan to go into apply, kinesiology and physiology? What is your plans for the future?
Yes. So I went into applied physiology and kinesiology because I've wanted to be a physical therapist for years now, like probably about 4 or 5. And so that is the end goal, is to go into physical therapy school and get my DPT. But I'll be taking a gap year between now and then, being that this is my senior year. So yeah.
Excellent. Why did you want to become a physical therapist?
I just really liked the idea of, like, I mean, obviously a lot of different jobs help people, and that was one of the goals, but I like the way that we do it in physical therapy because it's very, like, it's a mixture of the hands-on and the, like, you're actually like, like dealing with a specific problem, but it's also that you're getting to know the person. Like, I hear the biggest complaint from kids going into med school is that, like, they're not going to get to talk to their patients, and they have like tiny amounts of time and they're running between rooms. And I feel like we really get to know our patients. And I like the idea that I can be social all day long and I'm not just staring at a computer screen in a cubicle for a job. And I don't know, everything about it just kind of fit. And also the body is just awesome and I love anatomy. So
Okay, excellent. Can you give us some valuable tips for two things? One can be patience, since you have been exposed to a lot of them during these 4 months, but as well, perhaps for some of your, classmates or people who is working on undergrad and thinking about going into PT school and thinking about, perhaps become oncology specialists afterwards. So what tips will you to us?
So I'll do students first, just because I have a little bit more, I feel like, knowledge with that. And the biggest thing is just that, I mean, I even told you this in my interview with you when I first wanted to come here, was just that we don't learn much about cancer or oncology in general. It's the, like, uncontrolled dividing of a cell, but that doesn't mean anything when you talk about an actual person. Whereas here, I mean, you see all the different things and you see all the different ways, because there's so many types of cancer and there's so many ways that it affects people, and everyone's different, which, like, it's easy enough to just say that, but actually seeing it is huge. So I would encourage anybody who's going into physical therapy to see some sort of an oncology setting, because that was the main reason why I wanted to come here. Is I've seen pediatrics, I've seen outpatient, I've seen neuro, I've seen all these different things, and I love all those things, but it's when it's somebody's life and it's somebody who, like, went from being completely normal and now suddenly they have 1,000 different doctor's appointments and they feel normal other than the fact that they have something that they can't see and they can't control. Like, it's just a very different, there's a lot more psychologically that goes into it. And I think that for someone to see that, to kind of understand that difference of treatment, like, before they're going into PT school, is huge.
Great, very good. How about for patients?
For patients, honestly, the biggest thing is just that, like, they're capable of a lot more than they realize they are. I mean, we've seen people come in a wheelchair and, like, they leave walking after a couple weeks, and that's huge, and so many people, like, it depends on, obviously, like, what you're used to. We have people who come in who were athletes before and they're frustrated because they can't lift the amount of weight that they had before. And then we have people who came in completely sedentary and now they're actually exercising for the first time in their lives. And it's crazy, but they're capable of it. And so many of them struggle with that. And even when they do the thing, you have to be like, hey, look, you just finished a HIIT workout. You just did this incredible thing. And they, like, don't realize it. So I feel like my biggest thing is just to remind patients that they are capable of so much and that they need to give themselves a little bit of credit and a little bit of grace going through this process.
Great. How about a painful lesson that you learn along the way, as well as a student and as well, like, with patients with cancer?
So, well, as a student, and you know this because you've had to deal with me for the past however many weeks, is that I'm very stubborn and I don't like being wrong and I don't like being told what to do. And none of those are good as a student in an internship. So that's been a lot to figure out. But it's been a huge learning opportunity and like understanding like, okay, like and I mean, I'm glad I haven't completely annoyed you because I do like to challenge things. And if you say do this, then I'll be like, why? And so, but
Perfect.
it's
That's
been,
exactly what I want to encourage everyone to do. Absolutely. Yeah.
well, that's good. And I'm glad because I've learned a lot and I'm getting a tiny, tiny bit better about taking constructive criticism and honestly a lot better than where I started. So I'm very happy with that. And that's definitely been, I wouldn't say painful, but it's been frustrating, but it's definitely good. And from a patient perspective, like I think the biggest thing was that kind of going back to that whole like we don't know a whole lot about cancer in school. And it's just kind of this like thing, it's this word, it's like it's over there. It's not something that we see, but the biggest thing is that like seeing all of these patients, they all still have lives, they're still parents and there's still like a mom that wants to go to their kid's soccer game, but they're in radiation, so they can't be in the sun. And like they have a job, but like they're in chemotherapy and they're fatigued. And it's just crazy to see like all of these different people. Like we have people that work a night shift and they come here in the morning to do their HIIT workout before radiation. And then we have people who like, we have one patient who's like said that she just wanted to work the entire time through. So she'll be in a waiting room between appointments, like doing work on her laptop. And it's just kind of crazy. I mean, it was more shocking, I guess, than painful, but it was just like it just hits a lot harder because you see how much it's not just affecting like this one person. It's like it's still their entire lives and they still have kids and families and responsibilities. And some of them take on way more than they should while they're going through this process. And it's just, I don't know. I think that kind of hit me kind of hard when I first like started working here.
Okay. Well, you've been a really powerful part of really encourage our patients to be able to do all those things, right? They come in and sometimes it's like, are you kidding me? Are you want me to really ride on that bike? And you want me to go into like 70% of my heart rate? Are you out of your mind? And they roll the eyes and so forth. And, and then after work, 45 minutes later, they're like day at night, how they come in and how they go out. And sometimes I believe that when they come to us in the middle of all these treatments and everything they experience, we're kind of like their highlight of their day, I want to say. They're actually looking forward, even though sometimes they hate me, they're looking forward to come and see us because it's not just make them feel better, all the manual therapy that we do on them, but as well is by able to really encourage them and make them feel like they're capable of going through this and fighting this and some of those secondary effects that some of these treatments can create. So thank you for that.
Yeah.
What it means to advocate for yourself and how can people do that?
Biggest thing, honestly, um, so looking at it from a perspective of like a student or of like a patient.
Both.
Okay. So I'll start with patient. And so from that perspective, like I feel like a lot of it, because we see them come in and like, and you can see they're flustered and they've just like if say it's a new patient and they've just gotten all this new information. We talk about this all the time, how like they probably only hear like 10% of what we're telling them because they just have all of this new information thrown at them. And I believe like the biggest thing that causes fear is just not knowing things. And a lot of people are scared to research and they're scared to figure out what's going on, But a huge part of that is like doing the research and asking the questions and like they're hearing all of these things of all these different numbers and letters and like I still don't actually know what ER, PR, da 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 and all of that. And it's a lot, it's overwhelming. And so I think a big thing for a patient is just to like, like once they receive all the initial information is to like go through and be like, what do I understand? What do I not? And really like be okay with like being annoying to a doctor and just being like, I have questions. I need to know this. And because that's huge. It's a huge mental thing. And like, if you're fighting something that you don't understand, then it's just going to cause so much more anxiety and fear, I feel like. So that's a big thing with our patients is just like being able to speak up and be like, I don't know what this is. I don't know what this means. You're throwing a lot of terms at me. And some of our patients do. And other ones, like they'll come in and they'll be like, yeah, I just got this thing. And you're like, no, that's not what that means. It's okay. This is a good thing. And then they're like, oh, okay, that's great. You know? And so I feel like that's a huge part of it. Um, and then as a student, a lot of advocating is just, well, I mean, I said this before, but kind of just being okay with being annoying. And like, I'll ask you 1,000 questions and I'll be like, okay, but I want to know this. Okay, but how does this work? And why is this? And like, sometimes you're in the middle of 1,000 different things. And I'm like, hey, what's going on? And you're like, no, not right now. And that's okay. But, but eventually, like, you know, we come back to it and you learn about it. And from a student perspective, I mean, like, personally, I think I advocated for myself by being like, I want an oncology setting. Yours was the only internship I applied for because honestly, it was the only one I was interested in because I was like, this is what I want, this is what I haven't seen, and I need that knowledge like to go forward. And I'm glad that I did because I've had an incredible time here and it's been incredibly like valuable knowledge-wise and stuff. So I would say things like that, and then just reaching out and like I have students that I coach all the time when it comes to applying for grad school and all of that. And it's like, no, you need to be willing to email people and call people and be like, hey, I want to shadow. Hey, I want to see this. And the worst they can say is no. So that's a big thing. But I feel like the worst they can say is no is applicable for pretty much anyone for any phase of life. So yeah.
Okay, awesome. So what are good resources for patients to use to educate themselves? And I know sometimes, you know, where you have heard us doing an education for these 4 months, if you have somebody who comes and say, where can I find more information about this, you know, diagnose, or my medical oncologist is telling me this, what are your thoughts? What guidance will you give them if you can think of anything?
Um, My big thing when it comes to education is like making it small, like bite-sized, manageable sort of a thing. So like when it comes to like you have all of the sheets that we give our patients when they come in, like I think that's good because it's a paper. It's like here, read this paper, like, you know, underline it, highlight it, figure out what you don't know, and then you can ask about it later. And then honestly, like what I found helps a lot when it comes to learning about new things is even on like Instagram or Facebook or some sort of social media and following pages that just give you information about things because it's like you're just casual, you're just scrolling and then like something pops up and it's like, oh, here's something new. But it's tiny, you know, it's not a massive article that's like 18 pages long and has 50 different charts. And you're like, I don't know what these words are. And something that's like, I guess that's what I would say. Other than that, I'm not entirely sure. I kind of Google a lot of things. So.
So, and again, and then you just mentioned a big word, and it's Google it. You know, we call it Dr. Google. So sometimes I try to encourage patients not to look into that when they're looking into, like, okay, what if I not agree with this treatment? I'm gonna say what Google is telling me, because Google is gonna just tell you general information. So it's a lot of good resources that patients can go. The American Cancer Society is a great resource. It is so many like podcasts, and through this podcast you actually has been helping me to actually, I'm trying to put a list together for like what are the best resources from the podcasts, websites, books, and it is coming from actually physicians and people who is on the healthcare who really is talking with evidence base, and not it's just a general information. So it's not a bad thing to look into general information, but if it's going to be coming down to make a decision what is best for you, the best thing to do is to try to really go more into those sources. So, but again, that's what we are all the time right now, right? Everything is about social media. So, but don't let everything that says on social media being true, because that is overwhelming. Some people is going to tell the story how they live the story. So their story is not necessarily your story, right? So everybody behaves different, and that shouldn't be encouraged or discouraged to take any treatments based on their experience, because your body can be completely different. So that's important. Any podcast books that you will recommend?
Like for a cancer perspective or just in general?
Well, both. Can be both. Can be for mental health, can be to help you balance. So anything that can be helpful when you're going through rough time.
Honestly, like from like if you're talking more of like the self-help and educational, I'm not entirely sure. I looked through the list when we were compiling the list of like resources, and I mean, there's a ton of good ones that I'm planning on checking out at some point. I haven't yet. And obviously your podcast. But if we're just talking about like general books, just like for fun, because there were some of that also on the list. One that I really like is called The Rose Code. And it's about essentially like a female network of spies during World War II. It's historical fiction, but it's just very empowering and it's very like uplifting, I think. And especially when you're going through something like this, I feel like that might be good and helpful. So yeah.
Excellent. It is one question you wish I would have asked you, and will be have your answer.
We covered this a tiny bit at the beginning, but I guess like kind of just what will I like if you were to ask me like what's from this will I bring forward with me into like the future and into my future career and all of that? Because I mean that is kind of the goal, is to lead up to that.
Yeah.
And well, honestly, like we talk a lot about like when you're a PT and when you do that. And I appreciate that like you look at it through that lens, because even though I came in saying that like you didn't have to do that during the internship, you could just be like, yeah, go clean the table, you know? But like you put a lot into like making sure like I understand the like kinematics of this is how a shoulder joint works, and if this muscle does this, then why is there a problem with this, and like that sort of a thing. So I mean, like from a purely physical perspective, I'll take that through and take that kind of like puzzle piece way of putting things together like with me, because I really like that way of thinking about the body. But also I think a lot of it is like my biggest fear was that I wouldn't be able to push patients, you know, like coming into this internship and even just thinking about PT school, I was like, if I was going to be a physical therapist, what if I can't push my patients? What if I'm like too afraid to challenge them? And I feel like I've learned a lot about that, honestly, and I've gotten a little bit meaner, but like, you know, in a nice way, and being able to like push them. But it's also a lot of what I've learned from this is how to read them when they're coming in, because we've had patients that are coming in crying. We've had patients that are, you know, they're struggling, or they had a bad day, or they're exhausted because they just got off a night shift. And it's a lot of meeting them halfway. And it's like, we're not going to let them, you know, just get off the hook and just not exercise, because that defeats the whole point of what we do. But I loved watching like you work with your patients and just be this very comforting and just like honestly kind of maternal energy that's just like, no, it's okay, we're gonna get through this, we're gonna get better. And I see like how much of an impact that has on them, because we can't separate mental and physical, but like our job is to treat the physical, so we have to support the mental while treating the physical. And I think that's something that I'll definitely take forward with me.
Excellent. Were you thinking to be, after you get into PT school, which I'm sure you will do that next year, but were you thinking to pursue perhaps psychology when you graduate?
I'm honestly not sure. There's a lot that I like about it, and there's a lot that's really interesting, because like it is that puzzle, and I mean I've talked a lot about how I like that, but I also really like neuro and I really like pediatrics, and so I'm not sure. I'll have to see in the future, but it's something I probably wouldn't have considered before, because like I would have been like, ah, no, that's scary. It's this thing I don't know. And now I feel a lot more comfortable with it and a lot more interested in it. So maybe we'll see.
Okay, great. Well, where are you from, Emily?
I'm from Fort Myers originally.
All right, okay. So I think your plan is to stay here in Gainesville for a year and then apply.
Yes,
Okay, okay.
absolutely. Yeah.
Excellent. Well, Emily, thank you again for not just being part of this show, but for just really putting up with me for the last 4 months. I know I push and I push a lot, but with one good thing in mind, right? Just to just make you better. And just kind of really, I always say most of the students, or I will say almost every one of them, who has been here in their as an undergrad and APK, they do so well in PT school or PA or whatever career they pursue. I think that definitely we creating that seat on you guys, and then you sharing with the other students and all the interns that are here really help you. And I only hear really good outcomes and how much just this experience will help you in the future. So I think you'll do great.
Well, thank you. And I
Yeah,
appreciate the pushing. I needed it. And I can definitely see a difference in myself from then to now. And so thank you for everything, seriously, that you've done. It's been an amazing experience.
excellent. Well, thank you again for being part of this show again. And we're gonna miss you here, but no, we're gonna keep in touch for sure. So
Yeah.
thanks, Emily. Have a great rest of the day.
No problem. Thank you.
Bye.